I get to know my patients by knowing their medical problems and making sure that their medical problems all get addressed. It is very important that they understand that their medical problems are their problems, and I'm here to guide them the right way. I'm here to teach them what to do, what not to do, and how they can continue to live their life with the least amount of problems as possible. So it is very important to get to know your patient and also get to know the family members, because the family members, they contribute to the well-being of the patient by pointing out certain factors that the patients sometimes tend to overlook or forget because of the stress of coming to a doctor's office. Well, getting an appointment to practice is very easy. You just got to show up. I mean, I think it is very important that if you're sick, you see your doctor. It is a doctor is of no use to you when you're sick and you got to wait 2 weeks. Just show up, and once you show up, we won't turn you away. The great majority of the patients are more than 50. A lot of them are seniors. I enjoy talking to the seniors because they're more disciplined on what they do and what the instructions you give them. They come with their little papers and they want to address everything. And just like they come with a paper, they leave with a paper, because I also give them a lot of instructions. So it goes both ways. So dealing with the seniors is very nice because they tend to be more organized. The passion of medicine comes specifically with the cases that no one else can figure it out. That's what I enjoy. I enjoy the difficult cases, and basically what I do is I tell the patients, let's do the workup and see what we can come up with. Give me 2 visits, and in 2 visits you're going to have a diagnosis and figure out exactly what's going on with you. I've diagnosed a lot of patients with problems that they didn't know what was going on, and it turns out to be something drastic. So I like to be the one telling the patient that they're okay. The foods to avoid are those processed starches. Anything that is a processed starch is not going to be practical for you, because the amount of calories that you get concentrated on 5 grams of the food is too much compared to the kind of the amount of calories you get, for example, on a piece of broccoli or cauliflower, green beans. So you want to avoid anything that is in what I call the pasta, the rice, the potatoes, desserts,